We're here today at the SEAK National Workers' Compensation and Occupational Medicine Conference with Dr. Anthony Mollano, who specializes in occupational hand injuries. Dr. Mollano, what are some of the most common occupational hand injuries and conditions you see in your practice?
Probably the top three conditions that I take care of are carpal tunnel syndrome being number one, but the other two being injuries that result in tendinitis in the fingers or the wrist, and injuries that result in aggravation of symptoms of arthritis, more so in the thumb than in the wrist.
And how do you determine which of the hand conditions are work-related?
The state laws in different states vary on that, but in the state of New Hampshire, the state laws truly direct that if injuries exacerbate or worsen a condition, then that injury usually is a work compensable condition.
And so what are some of the common mistakes you see in the treatment and rehabilitation of workers who suffer hand injuries or conditions?
Workers with hand injuries need an extra amount of education on what the causes of a lot of the different conditions are, such as carpal tunnel and tendinitis. And there's a lot of lay knowledge and myths surrounding that. And it's common that people run into problems thinking that their injury or their illness was caused by something that isn't the truth. And so education is important so that people understand what the cause of their problem was. And that's part of the important treatment that helps people get better, is to be able to not fear going back, for example, to a work that won't cause that same injury if they get better. And so I think really education and appreciating the biopsychosocial nature of a lot of these hand problems and injuries is important.
The last question, how can employers and self-insurers help get their injured workers back to work?
The key is for patients who have injuries to be seen frequently, and in the hand, it is important for patients to rarely be completely taken out of work, and for patients to be treated in a way that gets them back to work in a reasonable way, involves education, frequent visits with a specialist, and appropriate gradual changes in their restrictions that are safe and reasonable throughout the recovery process.
Thank you very much, Dr.
Yeah, thank you.